Good morning, everyone. My name is Elena Saenz. I am the Associate Senior Vice President for Academic Affairs at Montgomery College, and it's my very distinct pleasure to introduce to you our next two speakers. Mr. Diego Uriburu is the co-founder of Identity and served as the Executive Deputy Director from 2004 until 2011, when he assumed the position of Executive Director. In this capacity, he is responsible for the strategic direction of the organization and the stewardship of a broad range of federal, state, local, and private grants. Prior to co-founding Identity, Diego worked as a psychotherapist at various community-based organizations in the Washington, D.C. area that work with the Latino population. Diego participates in several Montgomery County task force and working groups. He is the co-chair of the Latino Youth Collaborative Oversight Committee and the Steering Committee for the Latino Youth Initiative. He is also a member of the Steering Committee for Nonprofit Montgomery and the Latino Public Safety Work Group. Diego holds a master's degree in clinical psychology from the University of Belgrano in Argentina. Please welcome Mr. Uriburu to the stand.
Thank you. Buenos días, good morning. So I was very inspired by Dr. Williams' presentation, so I decided to change mine. So let's see how this goes. Right? So before starting, most of you, maybe all of you, don't know who I am as a person, but I think that I've been thinking about equity since I was a very, very young boy. I'm one of 4 brothers. We all misbehave very much. In Argentina, they called us the Uriburu. From now on, you call me Diego, but they call us the Uriburu Indians because we're always in trouble, the other Indians. And the first time I thought about equity was I was diagnosed with a very rare disease when I was 10 years old. And it was a blood disease, and I had to spend 3 months in bed hoping that it would go away. In 90% of the cases it did, but in my case it didn't. So that's led for me developing a kidney disease, and they told me that in 10 years my kidneys will be gone, I'll be in dialysis, I would need a transplant. So I wondered why, amongst the 4 of us, why did I get that? No? And my family is very Catholic, or was very Catholic, but I was never Catholic. I was baptized, but I never went to church. I didn't want to go to church. But a friend of mine, when I was 12 or so, invited me to go to a beautiful place that had wonderful waterfalls and rivers, but they were building a church there because apparently the Virgin had appeared. So he wanted to go to the church with the family, and I wanted to go to the river. So I went to the river, I jumped off the waterfall a few times, and when I got tired, I went to the church. There was a long, long line to get into the church, and they were just at the entrance, so I went in with them, and everyone went. There was a statue of the Virgin with a hand like this, and you had to put your hand on top of her hand and say something. And I was wondering, what the heck am I going to say when I get there, because I was at the church, so I was going to say something too, because I did not lose anything by trying, see if it worked. But what I said to her when I got there was, I don't understand why I'm getting this illness, and my brothers, which were my reference at the time, didn't. But whatever it is, whatever the reason is, I'll take it. And I'll try to be as strong as I can. The second time that I thought about equity was when I was probably 14, befriended a young homeless boy. And he was phenomenal, and I fell in love with him, and I took him to my house and asked my mother to please adopt him. She didn't, because I felt that the only chance he had in order to succeed was to have a similar environment to the one I was living in. She didn't, but she and my family worked with him and helped him with education and many other things, and he's having a good life today. I'm telling you this because now I'm in the privileged position to being the executive director of Identity, which is a nonprofit organization here in Montgomery County that works with mainly Latino youth and families. We work with young people in elementary schools, middle schools, high schools. We have centers for disconnected youth, and we also provide services at the correctional facilities. And we see inequities every single day. And we try to fight inequities in two main ways. One is through programs, and the other one is through advocacy. So I was going to spend most of my time showing you data, but I want to share with you what we're doing, because it's about moving to action and see what you think. Dr. Williams talked a lot about innovation. And to me, one of the mantras that had led my life in terms of innovation, and I just realized that, was a quote from Samuel Beckett: "Ever tried, ever failed? No matter. Try again, fail better." And I think we're all in the business, or should be in the business, of trying harder and failing better. So, as Identity, as an organization that has the privilege to work for this community, we do and have tried to do a lot of advocacy. And it has not been easy, hasn't been easy at all, and we failed many, many, many times. Last November, we held, trying to try again and to fail better, we had an event called The Promise of Latino Youth. And in that event, we brought someone with a national perspective, and we partnered with the University of Maryland to create a report that showed the inequities and to compare what was happening at the federal level, national level, with what was happening here in Montgomery County. And the commonality between the national stage and Montgomery County was that Latinos in general had very, very high expectations, lots of dreams, but as time went by, those dreams began to fade, and the realities that both young people and adults face were far, far away from the dreams that they had. And we were able to track how the young people, the older they got, the lower their expectations become. So I'll share quickly some of the data, and I'll tell you what we're doing, okay? So in Montgomery County, only 35% of Latinos showed that they're ready for kindergarten. Only 35%. That means that 65% are not ready for kindergarten. For African Americans, it's 46%. When you look at reading at grade level by third grade, Latinos, only 27% of Latinos read at grade level by third grade. And that's a huge benchmark. If you don't meet that benchmark, the likelihood of you doing well in school is very low. For our African American brothers, it's 36%. And for white students, it's 66%. In terms of graduation rates for Latinos, it's around 78%. So we focus on three areas: education, social emotional, and workforce development. In terms of social emotional, the blue is Maryland youth. The gray is Latino youth in general in Maryland, and the orange is the identity youth, the youth that we work with. And these are some of the questions that the CDC asks about ACEs, traumatic events in their lives that impact their well-being. And when you have 3 or more ACEs, it affects you not just mentally, but also physically. It's a physiological response to stress. And the amount of ACEs, the level of ACEs that the young people that we serve have is a lot higher than young people in Maryland and in the United States. And these questions these are the same questions that the CDC asks of young people all around the country. And we have a separate tool that asks about immigration-related ACEs. No? If a young person has been seeing their parents, without seeing their parents for 10 years or so, all those ACEs are in addition to the ones that I'm showing you. The levels of depressions are really high as well. When we look at workforce development, we look at the dropout rate. The dropout rate for Latinos in Montgomery County is around 15, 16%. But when you see or look at the dropout rate for ESOL students, it's in the 40%, 46%, I think it is. Here is the college completion. Only 25% of Latinos in Montgomery County have a bachelor's degree. And for Montgomery College that is trying to work hard, only 10% of Latino students in Montgomery College earn an associate's degree within 3 years. But I know that you're working hard to turn that around. And I'm happy to count Identity and myself as a partner with the college. And I'll talk more about that later. 6 in 10 Latinos in Montgomery County work in low-wage occupations and that do not offer health insurance. And in terms of earnings or household incomes, Latinos and African Americans are in the $68,000 range, while whites are $122,000. So we showcased those numbers, and then we came up with a call to action, and we focused on 5 areas: improving social and emotional well-being, kindergarten readiness, on-level reading by 3rd grade, high school graduation, and work readiness. And this is what we promised that we would do: a way to try harder, fail better, and fail again, but better this time. To empower our young students and their parents to advocate for themselves. We wanted to hold ourselves and others accountable. We wanted to partner with those who suffer similar wounds. And we wanted to keep the sense of urgency front and center. A few months ago, maybe 8 months ago, I had a meeting with Dr. Smith, the superintendent of schools, and they were talking about the strategies, and I brought to them the sense of urgency. And his response was not okay with me, and I mentioned to him that the timing of institutions, of big institutions like the school system, like the college, is not the same timing as the community. Every year that passes, if you think about one particular person or 2 or thousands, it's thousands of young people whose lives get affected by our inability to change rapidly. So urgency, the meaning of the word urgency differs greatly between being a member of the community who is not being served, who's not being given the same opportunities as others, than if you're an institution that needs the time in order to make the changes that you have to do. So this is what we did. We know we have tried many times and failed many times to change systems, because the systems are the ones that serve the most number of young people. So you have to work with the systems. We have always partnered with the systems. We do a lot of research, community-based research. We have data that probably no one else has about this community. And then we get the data and we show it to our partners and we say, this is happening, we have to do something about that. And then we do an action, we bring hundreds of people to an event, and the leadership of the institution says, yes, we're going to do it. And we were called to be part of a task force, but after a year or 2, we are so overwhelmed that we have to go focus on our business of running Identity, and then the efforts fade, and things more or less stay the same. So we decided this time around to do something different. We want to involve the community. Our community has been very passive. Our community is a community of survivors. So most of them are here surviving. They work 2, 3 jobs. The kids have different responsibilities. And so it's hard to focus on equity, which is a long-term goal, when you are surviving. So that is my role, but it's also my role to support them as they become equity warriors themselves. So the first thing that we did is we started a leadership academy within Identity, and last year we trained 75 parents to advocate within their communities, the schools, and system-wide issues. This year, we're going to start in July. We're going to start with another cadre of parents, and we're going to start a leadership academy for young people also. So we are trying to empower the community, so the community is the one that leads. So has been us leading for a long time, and I have failed miserably. So we need them because they need to advocate for themselves, and we are going to provide them with the tools and the support that they need. The second thing that we did, which to me is the most exciting, is the Latino community alone doesn't have a strong enough voice in order to make changes, lasting changes. We just don't. And for a few years, I have personally been trying to partner with the African American community. If you look at the numbers, are very similar. We have the misfortune to compete against each other as to who does worse in what. So the first time that we tried to come together, I met with my friend Byron Jones from the NAACP. He's the head of the NAACP Parent Council. And we agreed that the best way for both our communities to move forward was to partner. So we said, okay, we get along, we are aligned, let's bring our other colleagues to the table to partner. So we said, you go to your people, I go to my people, let's see what they say, and then we come together. So a month went by, we got together again, and I asked him, so what did your people say? And he said, well, my people don't want to work with your people because we are talking a lot about black and brown all the time, and you only talk about brown. And I said, you're right. And then he said, what did your people say? I said, well, my people don't want to partner with your people because we don't know who your people are. No? Because you say one thing and someone else says another thing, and you contradict each other, so we don't know who to partner with. So what we decided to do was, regardless of the barriers, that we were going to partner, lead by example, and see where that led. And that was a year and a half ago. And we testified jointly at the Board of Education. We met with county officials together. And for the first time, I think in Montgomery County's history, we had a joint action a few weeks ago. Montgomery County Public Schools issued a report, the Equity Accountability Report, that shows each school, how each school is doing in terms of farms African Americans and farm Hispanics. And we sent a letter, a joint letter, to the 3 associate superintendents demanding to meet with us to tell us what their plans are, to share what their plans, their strategies, and how do they intend to measure. Because Dr. Williams said you have to be able to measure it. If you cannot measure the change, then it's not happening. We also told them that we want to partner with them, because it's not only their responsibility, it's also our responsibility. And for the first time now, we are, between the two communities, we make up 52% of MCPS's student body. 52%. So our voice has to be heard. But if it's only one of us, it won't happen. So our strategy is to work together, to bring other people to the table, and to make sure that we put our children front and center. They come first. Everyone knows, most of you know about, and I can't pronounce it, but NIMBY, no? Not in my backyard. So Montgomery County is a very progressive county. It's a very progressive county. You're going to hear from our council president, Navarro, later, and their equity initiative, which I think is phenomenal. But my perception is that that alone is not enough. No? That if we don't take it, if we don't go to the streets, if we don't do it, it won't happen. So one of the things that we plan to do, and this is for you to, and basically I'm sharing with you what we're trying to do. No? How are we trying to do things differently? How are we trying to work harder? So if we put these young people front and center, no, because they should be front and center, then all the different institutions that have responsibilities to their members, to their staff, etc., have to put these young people first. So we believe that it can be done. We met with the school system together and we say, we don't understand. Every 4 years, you spend $10 billion in education. So it's not an issue of funding. $10 billion every 4 years. And what do you have to show for? What do we have to show for? And we look at these numbers, there's not much to show. So we wonder, what does it take? Is it an impossibility? No, that every 4 years, $10 billion, it's been however many years, so it's north of 20, $30 billion, and we have not made a dent, no, in the academic achievement of black and brown students, particularly the farm ones. So what does it take? And then we wonder ourselves, what is our role? So, and that's where we are right now. So we're now trying to plan how is it that we're going to move forward. Our idea is to meet with the associate superintendents and others, hear what they have to say about best practices. We are doing our own research about what we think the best practices are, and we want to implement them. We know there are barriers to implementation. Thank you. There's lots of barriers to implementation, but those barriers must be overcome. Changes need to happen that make people uncomfortable. No? People might not get what they want all the time, but if that needs to happen in order for our students to succeed, then so be it. And we are uniting forces in order to demand that that happens. So people need to be a little less comfortable. So the other thing that's very important is that you take part on this process. One of our biggest allies has been for identity during these difficult times for the Latino community with our president, not president of the college, but president who's here in DC, has been the tremendous amount of hate that has put a community on edge. And one of the biggest surprises that we had was a group of privileged white folks in Bethesda called Neighbors Rising, who rose to the occasion, and they have been the best defenders of our community that I have ever seen. They decided to not stay in the trenches, but to get involved. So now we're having our 20th anniversary in September, and we're going to recognize them for their leadership. And I want to talk about the college for a little bit. The college, one of our issues is workforce development. The college is the entity for workforce development. If you want to make systemic changes in the workforce development area, you have to look at the college. So the college, I'm thinking about how I'm going to say this. The college has emphasized for decades and decades the courses that lead to a diploma. So we spoke with the college, and the college listened. And we asked for the college to put more money towards non-credited courses, no? For certifications and trainings. And I'm very pleased to tell you that within a month of that conversation, the college put aside around $43,000 or so, not to identity, but for any students that we referred will get a free scholarship in order to take a non-credit course such as CNA, CMA, etc. And that has provided right now around 40 or so young people with an opportunity that they never thought they would have. And we hope to ask a lot more from the college. So thank you. So there's a sense of urgency. We all need to be part of the process. We all should be enraged at what's happening with black and brown people of color. Well, that's a redundancy. Black and brown, poor, young people in the community. We should all be enraged. And we should not just be on the sidelines and be enraged. We should be part of a movement that demands that change happens. So it is true that sometimes things happen from the top down, but many other times the real change happens when the community gets together and demands change. And we are in the perfect place in Montgomery County. We're at a perfect time because both the county executive and the county council president and all the county council members are in agreement about how important equity is. And we are in the perfect place because we have great partners. And you should be very happy to know that we count Montgomery College, which is not a perfect institution, and I have yet to see a perfect institution, but it continues to strive to do things better, to try harder. So thank you very much.